All right. Cool. Thank you. Thanks, Polly.
Thank you.
Okay. I am going to talk about something that a lot of you are going to disagree with. And it's this bold, bold statement. Cycling shouldn't hurt. Oh, yeah, exactly. Well, it would be great if it didn't, but of course it does, right? So, in this presentation, I'm going to talk about head to toe. I'm going to give you, the cyclist, a little user manual for your body. How to tackle things, how to get through the ride if you're feeling pain somewhere, what to do off the bike to fix it. But then I'll also give you tips on like, hey, what could be wrong with your bike fit? And also what could be wrong with your body. And hence the name of my business and how it was born, Bike and Body. I'm a doctor of physical therapy by trade. And then I started to do clinical bike fitting as a specialty in 2012. I did some training out west in Seattle, did some other training in Boston. I've been to Colorado several times at the Medicine to Cycling Conference and really geeked out on this stuff. So it is definitely my niche. And I thoroughly believe that cycling shouldn't hurt. Now somebody came by my table earlier today and said, well, does that mean that if I ride 100 miles that I shouldn't have any pain? And I said, that's an amazing question. And the answer is, no, you shouldn't have any actual legit pain. Pain is different than soreness or lactic acid buildup in your muscles or just fatigue or burning from things just you're tired of holding your head up, stuff like that. But if you train appropriately for a certain distance or a certain event, no, you shouldn't have any pain. Your muscles are going to be sore for sure because you used them. When your muscles are used, you get lactic acid buildup, and then you get that stuff. That's why they say you foam roll afterwards, and then you stretch and you drink water and beer. So, like, that was a great point. What I'm going to be talking about today is like pain. This is the bad pain. Okay? When you lift weights at the gym, you get a good pain. You get that burn. Okay, I'd call that a good pain. I'm going to talk about bad pain today. Stuff that I think, in my opinion, is avoidable. So, that's a bold statement, but I'm willing to talk about it for hours on end. Not today, but. So there's 4 major reasons why, categories of why we actually hurt. One is overuse, which we're all going to experience at some point tomorrow. Potentially. If you train like a rock star, though, you won't experience it at all. Secondly, improper mechanics or poor form. You're not holding yourself right. Third is your poor fit. That's also the big reason why I would come into play, and you'd make a trip to Milwaukee and hang out with me for a few hours. And then trauma. There's the obvious one. If you don't keep the rubber side down, then yeah, something's going to hurt. So, underlying theme in this whole presentation is get a professional bike fit. Notice I didn't say come to Bike and Body and get a bike fit from Dr. Deb. I want you to get your bike fit. I really thoroughly believe that anyone that rides on 2 wheels, non-motorized, should get a bike fit. You don't need to be a high-level person to be appropriate for a bike fit. Everybody deserves it. Everyone needs it. And I'd be happy to see you. So make the trip to Milwaukee if you like, but if not, hey, if you're not close to me, email me. I'll send you somewhere else. I'm in contact with fitters all over the nation. So just get it done. And like I said, this presentation will cover head to toe. It will kind of give you a user manual for how to like do that preliminary troubleshooting that you might want to do on your own. Don't let it go too far, okay? That's the disclaimer. I'll go through this next. For each body area that I'm going to work through, bike fit issues is the first category. So little things on your bike that you could maybe try changing to remedy your pain. Second thing, body issues. So stuff that's tight. Stuff that might be immobile, like a tight muscle or a tight joint. On-bike health strategies. So that's stuff tomorrow when you're at mile 72 and you're like, oh, my neck really hurts. What do I do? Those are the things you're going to go to when you're on your bike, but you can't make any changes right now. You can do things to help. Off-bike fix strategies. Those are going to be the things you're going to do off the bike after you have that information from that ride where, oh crap, I'm continuously hurting right on the inside of my knee. I need to do something about it because this isn't going away. Okay? So, there's my disclaimer. Not everyone's textbook, of course. I had to be general here. After I'm done, feel free to come see me at my table towards the main entrance on that wall. If you want to talk about anything that you think might be different from what I present today, I totally love talking about it. Please consult a professional if this stuff isn't working. This is just meant to be a preliminary troubleshoot, okay? If the pain is severe, do not just mess around. Protect yourself. And this third thing is that the body needs time to adapt to any change. We're not really good at that as humans. We're so quick fix, right? We always want to get it done like yesterday. But let us physical therapists, clinical bike fitters, be your subtle reminder that, hey, this stuff can take weeks, months, up to a year for your body to adapt. Especially if you've been riding in one position for 20 years and then I make a change, it's going to take some time. So be patient with yourself. And the prize right there, winner. We all should be winners. Happy lifelong cycling. That's the biggest